Aloha, everybody. Dr. Clifton Otto here. And today I would like to share with you a talk on navigating cannabis choices and safe practices. This is a topic that was given to me by the Office of Medical Cannabis Control and Regulation for a talk that I just gave for their first educational event. Unfortunately, this event was not recorded, so I thought I'd do a quick recording of my presentation so those who are not present would have access to this information. Here are my disclosures, and here is my disclaimer, and a little bit about my background, including my certification as a cannabinoid medicine specialist and my role on the 2014 dispensary task force. I got into this subject because of a friend with colon cancer who I saw personally benefit from pain relief, nausea reduction, appetite stimulation. And I'm convinced that because of their medicinal use of cannabis, they were able to survive the chemotherapy before surgery, the pain after surgery, and the chemotherapy after surgery, because they were able to continue to eat and maintain their weight, which meant maintaining an intact immune system. And I'd like to jump right in with a patient example of a patient who purchased an infused chocolate bar with a total THC amount of 300 milligrams. This bar had 10 squares, and each square, therefore, had about 30 milligrams of THC per square. Unfortunately, this patient either did not read the label or didn't understand the label, so they did not understand that this bar contained 40 servings, which meant 4 servings per square. They thought reasonably enough that 1 square was a serving, and so they ate 1 square and had a THC toxicity reaction, which luckily was not life-threatening, but was very unpleasant for the patient. And so this gives us a good place to start with a discussion about harm reduction. And I think the approach that's been taken by the Substance Abuse and Mental Health Services Administration is very informative because at the very top of their list is respect autonomy. And, you know, this is for people who are using illegal drugs, which is a category that our medical cannabis patients fall into because they have to violate federal law to participate. And I think it's very important to respect the autonomy of our medical cannabis patients because of what they have to go through to engage in the state-authorized medical use of cannabis in terms of various forms of discrimination. And so we need to understand the patient's unique needs and how they are individually responding to their decision to self-treat themselves with medical cannabis. Medical cannabis patients represent a very unique group of patients and a unique group of cannabis users because they want to be functional. They're already dysfunctional because of their chronic disease. They don't want to be high. They don't want to be locked into a couch, not able to do anything. And they're primarily using medical cannabis products at night. Many after a long day's work or responsibilities during the day, using cannabis at night to recover, to get a good night's sleep and relief from their pain. And medical cannabis patients often are using as little cannabis as possible, which I think is a good way to distinguish medical cannabis patients from those who might be abusing cannabis. This journey begins with the certifying provider, who in Hawaii must be a physician or an APRN. They must be state licensed and have state and federal controlled substance prescribing registration. Certifying providers are not prescribing because we don't have an FDA-approved botanical drug product available in the pharmacy yet. And so we wouldn't really know what to write for. We are also not recommending cannabis. In some states, they call this process a recommendation. In Hawaii, it's called a written certification. So we're not actually recommending the medical use of cannabis. This is something that the patient decides for themselves, and certifying providers can certify that the patient meets certain criteria set by the state and can offer educational information and a follow-up within the doctor-patient relationship. And we are certainly not providing access. That would be aiding and abetting in gaining access to an illegal Schedule I drug under our federal prescribing registration. My feeling is that certifying providers should be certified. And I went through the American Academy of Cannabinoid Medicine, which required taking a certain number of continuing medical education credits at accredited national cannabinoid medicine conferences, being in practice for a certain number of years and taking an examination. And I feel there should be at least a minimum standard of competency that certifying providers can demonstrate in order to provide certifications. The certification evaluation should have several components. Obviously, medical history, drug interaction review, discussion of risk and benefits, products and dosages, which I'll get into more shortly, and a review of a self-treatment plan and access to follow-up, along with a written certification and submission of the registration application, which is required under state law. Evaluating a medical cannabis patient is not something that should just occur in 10 and 15 minutes and then out the door and go to the salespeople for medical advice. This includes a complex list of factors that will impact the patient's medical use of cannabis, including involvement of their medical team. We have to remember that this is confidential medical information. We can't force patients to share it with their other members of their medical team, especially if it could risk termination of care. But we have to recognize that it's up to the patient to decide how they want to share this information and try and support them as we can. There are several different routes of administration that need to be discussed during the certification evaluation. And of course, several different types of products that will be available to the patient. One product that I've yet to see is a suppository. And there's a lot of interest right now among patients who would like to do higher doses of cannabis, but do not or cannot tolerate the intoxication. There's some evidence to suggest that that rectal absorption does not lead to the same degree of intoxication that oral ingestion leads to. So perhaps this is something that can be made available. And if we can't call it a suppository, maybe we call it something like an Oshiri lozenge or something that makes it acceptable. We also need to mention home cultivation, which allows for reduced costs and the patient control over production and cultivar selection, which is important for many patients. And of course, lab testing is also available, which I hope can be made available at reduced costs for patients to allow for cannabinoid, but also terpene testing so that patients can get a better picture of what they're producing for themselves. And I think the goal of this self-treatment should be getting the most benefit with the lowest risk, using the least amount of material. And of course, we do need to recognize the health effects, especially the negative health effects that can be associated with cannabis. Here is a picture of the CDC's website. I'm putting some of these up here, not because I necessarily agree with everything that they have on their website, but because I think it gives a broader perspective that I hope will help us explore what is best for our patients. And they point out several health effects in their literature: cannabis use disorder, brain, heart health, driving, pulmonary impact, mental health issues, and unintentional poisoning. And here's an article that I think is very informative for providers on discussions that should be had in the medical evaluation, because they point out several risks based on a patient's cardiac history, pulmonary, neurologic, psychiatric history, pregnancy, adolescent use in the elderly, which can cause certain risks that are not present in the younger population, drug interactions, of course, impact upon driving, and perioperative use, which I don't think often gets much attention. Inhalation is a very common method of use for patients because the effect is fast and easy to control. But I think we need to recognize that smoke itself contains harmful chemicals. And there have been studies done that show that the harmful chemicals in marijuana and tobacco are very similar. And so I think from a medical perspective, we need to look at safer ways of inhaling cannabis. There's also the risk of creating toxic chemicals by overheating concentrates. So dabbing using a torch creates the risk of creating contaminants that also have carcinogenic properties. So discussions about low temp dabbing devices, making sure a temperature is not at a range that will cause harmful chemicals is very important in this area. And there's also some interesting research on the rate of decarboxylation during combustion and also vaporization. And I have some patients who tell me that smoking actually relieves their pain better than vaporizing in a dry herb vaporizer. And so we have to wonder, is there some difference in the rate of decarboxylation between combustion and vaporization that might make smoking more effective? Certainly something that needs to be researched and could certainly be done easily in the lab in order to help advise patients safely. But I think in the meantime, it would be great if we could get as many patients as possible to switch over to a safer method of inhalation, such as dry herb vaporizers. I don't have any financial interest in any of these products. I'm just putting these up there as a reference. There are some desktop models, handheld models. Basically, they allow the material to be heated to about 400 degrees, at which point patients inhale a vapor, not a smoke. Research has been done on this vapor using the gold standard, which is the volcano, and has shown that there are no harmful chemicals in this vapor. Now let's turn to dosing, taking cannabis by mouth, which is a tricky subject because we don't want to be giving out medical advice outside the doctor-patient relationship, but I think we can learn a lot from the way that cannabis has been formulated in FDA-approved drug products. So we've got Marinol, which you're familiar with, which interestingly enough comes in 2.55 and 10 milligram capsules. Now, these companies put in lots of time and millions of dollars working out what is a safe dose. So we could look at the 2.5 milligram dose and say, okay, maybe this would be a safe starting point because that's what they worked out in the FDA-approved clinical trials as the lowest dose. But of course, we need to also take into account the patient's own sensitivity because some patients may need less as a starting dose for THC. And we also have Syndros, which is FDA-approved Schedule 2, not available by renewable, just a one-time prescription because they feel it has a greater abuse potential in liquid form. But I think it's interesting to note the dosing, the concentration, 5 milligrams per milliliter, which is very clearly illustrated on the packaging, something that I think would be very helpful for patients if we had a consistent concentration so that patients could develop a consistent dose. And also this product lists refrigeration as storage requirements, which I think is very important for any product that contains THC. And then we have Sativex, which is still awaiting FDA approval in the US. And it's interesting to note that they, after all their millions of dollars of research, arrived at a 1-to-1 ratio. And you can also see they arrived at a dose of about 2.5 milligrams of THC and CBD. So that kind of correlates with the lowest dose of Marinol. So that can also help inform us on what might be some safe starting points and ratios for patients. The difficulty is using a product that has a fixed dosage. I mean, how do you cut up a gummy bear? Do you cut off its head? Do you cut off a leg? And of course, having a consistent dosage is more challenging. What would be, I think, more helpful is to have an infused oil with a graduated dropper with a known concentration so that patients could work out an effective dose and be able to consistently dose the same amount each time. Even better would be customized formulation at the point of sale where different infused oils could be modified by adding either more CBD or more THC to arrive at customized ratios based on the patient's response and the interaction with the certifying provider. The certificate of analysis is also something that's been discussed as a way to better customize individual use of medical cannabis. The dispensaries are not required to do terpene testing, but a lot of dispensaries are starting to do this, especially on their flower, because patients are asking for this information and they need this information to be able to figure out why certain varieties of flower are working particularly well for them. And this brings us back to our example of THC labeling or product labeling. And I think it really emphasizes the importance of patients understanding what's on the label of the product they're purchasing before they leave the dispensary. If you don't understand the product, get the salesperson to write it down. It may be in larger print, but patients need to understand the dosing, the serving size, which I think can also be misleading. But this needs to be clearly discussed in order to prevent any more toxicity episodes. And THC toxicity, acute THC toxicity, is a real danger for, especially for naive patients and patients who are taking these higher concentrated products by mouth. And toxicity includes several different features: anxiety, panic, increased heart rate, which can add to the anxiety, motor impairment, lethargy, nausea, vomiting, hypotension, hallucinations, agitation, which can also lead to acute psychosis, which is not something that you want to experience either firsthand or secondhand, but usually is not life-threatening as long as the person can be kept comfortable and allowed to sleep it off in a safe environment. But there are some anecdotal reports of CBD being used to reverse the toxicity of THC. I think more research needs to be done in this area as a potential way to reduce the risk of THC toxicity in medical cannabis patients. And the issue of tolerance, I think, is very interesting, typically associated with discussions of addiction, which I don't think is really a risk for medical cannabis patients. But tolerance can be an issue for those patients who are actually benefiting from the psychoactive effects of cannabis, such as the anxiolytic and euphoric inducing properties that can certainly be helpful for patients with PTSD and who need to avoid tolerance, something that patients are at risk at if they're always using the same material for prolonged periods of time, but something that can be addressed by mixing different varieties of cannabis to expose the person's cannabinoid receptors to a different cannabinoid spectrum that patients have reported can reduce the onset of tolerance to those desirable psychoactive properties. And of course, this also brings up the issue of research. There's so much research that needs to be done in this area. We have a state-of-the-art cancer center just waiting to do local research that unfortunately is being held up by the federal situation with cannabis right now. Hopefully, we can make some progress on that. A lot of research to be done in this area. So I look forward to that. And that's all I have. Thanks very much for watching. Any questions, please shoot me an email. And hope you have a great holiday season. Aloha, everybody. Be safe out there.